is your heads up. Medicare open enrollment starts today. It's your chance to review your coverage, make sure it still fits your needs. From now through December 7th, you can make changes to your Medicare Advantage or prescription drug plans. Experts are recommending comparing options every year since coverage, costs, and benefits can change to be sure you're getting the plan that does work best for you. So October is National Health Literacy Month, and this Wellness Wednesday, we are talking about a topic many men tend to put off, and that is their health. Dad, I'm talking to you. Joining us is Dr. Anthony Will, a family medicine specialist with Honor Health, who is here to break down why men may avoid the doctor. I feel like it's hard. I know a lot of ladies in their, have with a man in their life trying to tell them you have to take it seriously, but I don't understand maybe why they wouldn't.
Yeah, no, it's a great point. There's actually a lot of studies to validate that. So men historically do avoid the doctor, certainly more than women. Men seek what's called episodic care. So they wait till oftentimes there's a problem and then they go to the doctor. And as we know, preventative care is really the key. If there's a disease process or an illness, it's always better off if we can catch it early and treat it early. So one of the ways that we want to remedy that is a lot of our employers now will give benefits for men to take time off work and go to the physician, get a physical exam. Also, we want to make sure that we create opportunities. So telemedicine is a great example. It's not perfect, but it's a reasonable option for people who sometimes just feel like they're too busy.
Right. I mean, just a little more convenient for them to find a way to touch base a little bit.
Yeah.
I do find this with, men in different age groups. It really doesn't matter, but there can be more emphasis on when you should be getting checked regularly, maybe in your 50s, 60s, a little bit later. But there are things you should be checking in your 30s and 40s as well. Can you walk me through those kind of major points?
Yeah, so absolutely. So what we always say, no matter what decade of life you're in, 30s, 40s, 50s, we want to go to the basics. So we want to have a good diet. We want to have good exercise, and we want to have good sleep. So with diet, especially with obesity and diabetes epidemic, we want to watch our simple refined sugars. Processed foods have been linked to cancer, excess saturated fats and meats for heart disease and stroke. Exercise, we want to do about 150 minutes a week. If you're not doing any exercise, just start with simple things like walking.
Walking makes a huge difference.
It's huge. It's wonderful. It works. And if you know what, on your lunch break, go ahead and take like a 10 or 15-minute walk. That'll always help too. Just start simple. And then sleep is super important for our mental focus, our alertness. Our body repairs itself during sleep.
And that goes for everyone, by the way, not just men.
Absolutely. So what we want to do is we want to focus on getting about 7 to 8 hours of sleep. This helps our mental health. This helps our focus, our clarity. So when we get into our 30s, we want to develop those healthy habits we just discussed. When we get in our 40s, we want to make sure we're having regular physical exams. So we're showing up at least once a year for a physical. And then when we get into our 50s, we want to start talking about our cancer screening. So for example, colon cancer screening. As a matter of fact, we start that at 45, but we really start pushing that in our 50s. And then prostate health, men's health, and prostate cancer screening in the 50s as well.
Wow, that's so interesting. And I think that's a good takeaway, right? So, all the men who are watching this morning, or, those who have a man in their life who doesn't love to go get checked, these are the little steps that we can take depending on your age, what you can do here. And so it feels very difficult to just start anywhere. What's maybe the first step? I know we talked about walking, but maybe is there another easy step that we can kind of walk into our fitness journey or health journey?
And I want to emphasize too, finding a primary care provider that you can communicate with and you can build trust with and you can feel open to have communication and conversation is really important. But I would say, if we get to diet, exercise, and sleep, diet, watching just basic stuff, cutting back our portions, watching our excess sugars, watching our stuff in the grocery store that's in a package or that's in a can, that's processed foods. Exercise, get out on your breaks. Do, 5, 10, 15 minutes on your lunch breaks. Get out and walk. And sleep, really for our anxiety epidemic, for our mental health, our better mood, trying to really improve being in that bedroom for 8 hours and trying to get 7 to 8 hours of sleep.
We're trying. My husband and I have a 6-month-old who does not like to sleep right now. I don't even remember the last time either of us got 7 to 8 hours.
Congratulations.
Thank you. Yeah, it's a blessing, but whoo, are we tired? And so I know it will get better. And then I feel like we can really focus on the sleep part. But I love what you said, even just getting a physical once a year and then finding someone you can talk to, because I do feel like, I mean, you have probably better experience with this, but sometimes it feels like men can have trouble opening up, especially if they feel like it's an embarrassing ailment that they have.
Yeah, absolutely. Sometimes there's things that are tough to talk about.
Right.
And sometimes men will seek a male provider, and they can open up about those conversations that are difficult. Again, really having good communication, developing good trust with your primary care provider is really important.
Very important. Dr. Anthony Will, thank you so much for being here.
Thank you for having me.
Really appreciate it. I feel like some great takeaways this morning.